What is the history of the Whipple procedure for pancreatic cancer? The Whipple procedure, also called pancreatic hydrodectomy, has a fascinating history that shows how surgical techniques have evolved over time. It was first developed by a surgeon named Alan Oldfather Whipple in the early 1900s. Originally, the goal was to treat cancers located near the opening of the bile and pancreatic ducts, known as the periampullary region, which includes pancreatic cancer. Early attempts at removing parts of the pancreas and duodenum started in the late 1800s and early 1900s, but these surgeries were very risky and often not successful. In 1935, Whipple introduced a two-stage approach. The first stage focused on relieving jaundice caused by blockages in the bile duct. Surgeons created bypasses to help drain the bile and improve the patient's condition. Then, in a second surgery, they removed the affected area, including the ampulla of Vater and part of the pancreatic head. This staged method was used because surgeons were concerned about the risks of doing everything at once, given the high complication rates at that time. By 1940, Whipple performed the first successful one-stage pancreatic hydrodectomy, and interestingly, it was done during surgery that was initially planned for treating stomach cancer. This single operation involved removing the pancreatic head, duodenum, part of the stomach, and other nearby structures, then reconnecting the digestive tract. This breakthrough made the procedure more practical and safer for patients. Over the following decades, surgeons refined the technique further. They introduced variations like pylorus-preserving pancreatic hydrodectomy, which aimed to reduce complications such as delayed stomach emptying. As surgical methods, anesthesia, and post-operative care improved, the mortality rate dropped from nearly 45% to less than 1% in specialized centers. Today, the Whipple procedure remains the primary surgical option for patients with pancreatic head cancer, offering the best chance for cure when the disease is caught early enough. In summary, the history of the Whipple procedure reflects a journey from a risky, complex operation to a carefully refined surgery that has saved many lives. It highlights how medical advances and surgical innovation have made this procedure safer and more effective over time. Always remember, if you or someone you know is considering this surgery, consulting with experienced medical professionals is essential for personalized care.